Hey everybody, welcome back to Good Morning Arkansas. We are in the Little Rock Midtown Clinic of Healthy Connections. Pleased to be joined here by Dr. Sharon Meador. Thank you for talking to us this morning. We appreciate you being
Thank you for coming.
We're going to talk about something called medication-assisted treatment. And when we're talking about treatment, we're essentially talking about treatment for opioid abuse, right?
Well, and other substances of abuse also, meth and alcohol.
Oh, okay.
Yeah, but it's most effective. What we do with medication-assisted treatment is most effective for opioid substance disorders.
Okay, and so when we talk about medication-assisted therapy, there obviously is more than just counseling involved.
Exactly.
You're actually using FDA-approved medications.
We use FDA-approved medications that have been proved to be very effective. There is data and studies out that show it saves lives, it saves people from dying, it makes people more productive. It's an amazing process that helps a lot. But the medication, it's assisted. The medication-assisted treatment, the treatment is really important, and it's just not the medicine. It's getting counseling, it's getting some behavioral therapy, some group recovery systems. It all works together.
So it's what they refer to as a holistic approach
Exactly.
to the whole thing.
Exactly.
You've been doing this a long time. Give us an idea of how bad this problem is nationwide here in Arkansas.
Well, CDC just released the rough 2023 estimate. There were 112,000 overdose deaths nationwide. And that's just the reported ones, and that's just the deaths. That's not the people that wake up in the hospital and have been resuscitated or haven't given Narcan. And that's up from about 105,000 2 years ago. On the rise. In Arkansas, the last data we have is 2021, and there were a little over 600 overdose deaths that year. Most of the overdose deaths have some kind of opioid in them, involved with them. Lately, it's been fentanyl.
Yeah, right. We hear about that
in the
news all the time. Listen, you know, those who find themselves having an issue and a problem with opioids never plan to get in this spot.
And no one wants to have an addiction.
Sure.
No one wants to have a substance use disorder. I've never had any of my hundreds of patients tell me, I planned this. This is what I wanted to do with my life. It's not. Nobody plans it. It's a disease. It's a disease.
And some of these opioids are so powerful that you're not going to get out of this, in all likelihood, by yourself. You're going to need help.
Yes, I don't think anyone can get up it by themselves. Now, whether you use medication or not, there are other ways to get into sobriety and recovery. But the buprenorphine that we use in opioid substance abuse allows people to stay out of withdrawals. It gives them time for their brain cells to recover enough to learn how to deal with their substance use disorder. And some people need it forever. It's a medical illness. Some people don't have to have that help, but it just depends on how messed up their brain receptors are.
Yeah, exactly. Well, with your experience and all you've seen through the years, can people do this with one treatment? And I know it's a series of treatments, but can they generally do this on one try if they go through the treatment?
What I've seen is very few people do. Very few people go down the straight and narrow path of recovery. Some peer support folks that I've worked with have been in recovery 10, 12, 15 times, but now they've been in recovery for 12, 14, 15 years. It's hard. It's a hard disease. It's like telling somebody with diabetes, okay, you need to change your whole entire diet, lose 50 pounds, and you're going to be great.
Yeah.
Nobody does that.
Yeah, right, exactly. Mm-hmm. That's a tall hill to climb.
It is.
No question about it. If someone or someone who loves someone is having an issue and really wants to seek help, what do they need to do?
They need to contact somebody who has a recovery program in place. Our phone number should be on the screen, I hope.
There it is.
It's a central scheduling number. You can call and ask for the MAT program, M-A-T program, and they'll set you up an appointment with one of us who treats this illness.
And you'll give an evaluation and just
kind
of
a
baseline of where somebody is.
A lot of our folks come from recovery centers where they've actually been inpatient or intensive outpatient. They come from other centers and refer to us for long-term treatment because this doesn't go away overnight. I mean, I recommend a minimum of 18 months of of buprenorphine treatment.
Yeah. And of course, we're in the Midtown Clinic of Healthy Connections, but you've got clinics all over the
We do
office.
have multiple clinics all over the state. There's several that offer that program, and if they call that number, they'll tell them which one's closest to you.
Okay. Sounds wonderful. Thank you for this conversation.
Thank
I
you.
wish the numbers we had to talk about were not the numbers we're having to talk about, but in fact they are. So if you
Thanks
need some
for
help,
coming.
You're
Appreciate
welcome.
it.
Reach out if you need some help. Be back on Good Morning Arkansas right after this.